Right, so hello everybody. Thanks for joining us here on the Kidney Wales live Facebook feed question and answer session. We've had lots and lots of questions already sent through, and we'll go through every one of them, so don't worry, we'll cover everything. I think what the plan is really is I'm just going to give you a little bit of a general background, which hopefully will answer quite a few of the questions in any case, and then we'll go through each of the questions that you've asked. And if any of you have any other questions as we're going along, just post them in the comments bit, and we'll try our best to get through as many as we can. Hopefully you can all hear me okay to begin with. If not, somebody write a comment to say that you can't, and we'll start again. You won't be able to hear me say that either. Okay, fine. So, what are we here for? We're here to talk about coronavirus and COVID-19, and in particular how it's affecting our kidney community in Wales. So, in terms of background about the virus itself, this is completely new, obviously, as you know, and most of you are going to know all of this anyway, but this thing didn't even exist 4 months ago, and because of that we're in a bit of a difficult situation in terms of knowing how to manage it. It's a coronavirus, which is a type of virus that's the same group of viruses as the common cold, but it's much more severe than things like the common cold and influenza as well. And the main reason for that is that it hasn't existed in humans until only a few months ago. So what that means is that none of us have any immunity against it. So every single person in the world is at risk of picking up this infection. The vast majority of people who get an infection, and that's regardless to what your underlying health conditions are, the vast majority of people who get this will only have a mild illness. It'll feel a bit like a cold. Actually, quite a lot of people don't get any symptoms at all, and they'll recover completely from it. The problem is that a small number of patients develop a sort of secondary illness, if you like. It's a reaction, it's your own body's reaction against this virus, and that can be a very severe reaction, and it mostly affects your breathing. So it affects your body's ability to get oxygen into your bloodstream, and that can be very, very difficult to treat. It requires lots of oxygen therapy. Quite often, if you get really bad, it requires treatment on an intensive care unit. What we've seen around the world is, because nobody's experienced this infection before, everybody's prone to it, and those patients who are getting it are needing, only a small minority of them, but it's enough to overwhelm our normal healthcare service. So that's the reason why we need to take all these things seriously, and particularly for us as a kidney community, there are a few other things to bear in mind. We've got a lot of patients who have other health problems, which makes you more likely to suffer complications from this. We've of course got a big community of transplant patients in Wales, and transplant patients are, because of the drugs that you need to take to keep your kidney working, your kidney transplant working, stop your body from rejecting it, they of course make you more prone to picking up all sorts of other infections, and coronavirus is one of those. So the principles of what we're trying to achieve in looking after people with any people actually in the current climate is we try to minimise infections. So that's what the social distancing and the isolations and things have been all about. And we're particularly trying to protect a certain group of people who, if they get it, even though if they do get it, they're still likely to recover completely, but they would be more likely to get a serious version of the illness, and that's particularly the kidney transplant patients for us. We of course at the same time want to make sure that we can provide your normal care, and again this is really relevant for our kidney patients. So if you're a dialysis patient, we need to make sure that we can provide you with the dialysis care that you need. If you're a transplant patient, There's still other health problems that happen during any outbreak that happen all the time. We need to make sure that we're able to treat those things as well. So everything that we're trying to do is to keep you healthy, try and avoid you from picking up the infection in the first place, and if you do get it, trying to make sure that we can treat you in the right place. Now, with any sort of serious pandemic like this, one of the places that you're more likely to pick it up is actually in the hospital environment, because of course the hospital is going to be full of patients who've got this sort of infection. So one of the key bits that we're trying to achieve is to try and keep people out of hospitals if at all possible. So some of you will have noticed already that we've changed the way that we do in our outpatient appointments. So if you're a kidney patient, we're probably calling you less frequently. If you're a transplant patient, likewise. We're doing our best to try and manage things with you at home as much as possible. And that's to just to try and lower your risk of being exposed to anyone who might have this virus. And that's an important point in terms of who might have this, because the truth is anyone might have it and they may not necessarily have any symptoms. So the only safe thing to do is to assume that everybody that you meet has this and treat it as if it is, and that will reduce the chance of you then picking it up yourself. So sort of headline news, good news part of things, most people, including transplant patients, including hemodialysis patients, if you pick up this virus, it will be a mild illness and you'll recover from it completely without needing anything more than some paracetamol and some rest at home. The one other point, the virus you can't pick up infections from this through skin. So just touching someone who's got this isn't enough to get the virus. You get it by touching your face. Okay, so the virus has to cross the mucous membrane. So this is your mouth, your nose or your eyes. So even if you have a virus on your hand, as long as you don't touch your face, you won't pass that on. And this is the reason why hand washing is so effective at slowing down the spread of this disease. And actually that's relevant in hospitals as well. The single most important thing that we can do in hospitals stopping transmission is to making sure our hands are clean all the time. So really, really important for all of our kidney community, our patients and their relatives, to be washing their hands regularly. It doesn't have to be anything fancy, just soap and water. The long wash, you will have heard about 20 seconds at least. One thing that what I teach whenever we're learning to scrub up in theatre is rub your hands together until you see lots of bubbles forming on your hands. And that's usually a good sign that you're doing it for long enough. Keep rubbing, 20 seconds. Get between the fingers as well, both sides, thumbs, and that will significantly reduce your chance of passing on the infection to yourself if you happen to have touched somebody or something that had the virus on it, and passing it on to other people as well. The other thing that's really important, and I want to emphasise this, all of the evidence shows that shielding really works. Okay, so social isolation and social distancing definitely works the whole community. It lowers the number of infections, it allows the health service enough time to be able to cope with all of this. But shielding, so specifically shielding, so staying at home and following the advice the government have given on that score, it works. And we've got data from China that show this. So if you look at the Chinese experience where they've got tens of thousands of people infected, what they did was they advised their heart transplant recipients very early on, stay indoors, don't mix with anybody, including your family, or keep that to a minimum. And what we see from China is that the rates of infection in that group that should be really high risk of picking it up actually is lower than the general population. So that means shielding works. It means if you follow shielding, you will significantly lower your chance of getting this infection. So one big take-home message today, shielding works, stick with it. In terms of the sort of not so good news, one of the big things is this is a new virus, as I said already, which means we don't know that much about it. We're learning more all the time, lots of information coming through all the time, but we don't know a huge amount about this as yet. So that makes it a bit difficult to advise always, and that means that the advice that we're giving has changed a few times. The advice the government has given has changed a few times as well. And I know that can be really really confusing. Hopefully we'll try and iron out some of those uncertainties this evening. The other thing that's bad news, I've mentioned this already, the disease, it's quite easy to pass it on, and passing it on even when you don't have any symptoms of an infection yourself, you may still have the virus and you may still be able to pass this on. So this is where, again, go back to the same thing again, the safest thing to do is to assume that everybody you meet has got this, and that will reduce your risk of picking things up yourself. Okay, so that's a general overview of where we are. We've got all of your questions that have been sent through earlier. My wife is sat opposite me, and she's going to read them out. We won't say who said what, but we'll read out the gist of the questions, and we'll see if we can go through them one by one. So, Beth, first one.
Yeah. Okay. So our first question is from someone who's had a recent transplant, but also unfortunately suffers from health anxiety, and they are asking if they should still attend the transplant clinics.
Okay, so hopefully you can all hear that all right. Someone post something in the comments, please, just to say that you can hear what Beth was saying okay there, but I'll go on and answer in any case. So, yeah, this is a really important point, and it's a bit confusing, I admit. So this is someone who's had a recent transplant within the last 6 months, and in the early stages after a transplant, it's really important that we see patients regularly in the clinic. So we tend to see people, as any of you who've had a transplant will remember, those first few weeks we bring you back and forward several times a week to the clinic. And the important thing, and one of the points I made earlier on, is we're trying to get this right balance between keeping you at home where your risk of picking up the infection is low, but also looking after your kidney problems, looking after your transplant in the right way. So for this particular person, the right thing to do is to give the transplant team a ring, tell them your anxieties, and they can give you some advice about whether or not we definitely need to see you in this clinic appointment, or whether we can space those appointments out a little bit more, or whether we can do the consultation over the phone, which is possible in some cases. The early transplants, that's a little bit more difficult to do. And for transplant patients in general, it's a bit tricky because we need to do, those of you who've got transplants know, we need to do the blood levels to check things like your tacrolimus, to check that your kidney function is working okay. And to do that, we need the bloods to be taken somewhere. And the tacrolimus in particular, it's not the drug test that you can have done in your local GPs or anywhere else. We need to do it in the hospital. So it's a bit tricky, it's not perfect, but what we're saying is take the advice, individual advice from the transplant unit about whether you need to come or not. If we don't think you need to come, we will have already cancelled your appointment. So if your appointment's still there, that means we think we need to see you. One thing I should just say, for those of you who are seen in the transplant unit in Cardiff, we've completely changed the setup of the clinic. You won't recognise it. It's totally different to the normal. So the normal situation where you come on a Monday or a Thursday for most of you, sat cramped in a waiting room, hang around for 3 hours, have your bloods done and get the results. That doesn't happen. So what we're doing now is you come to the unit, we check that you don't have any symptoms before we let you on to the outpatient clinic, hand washing, into a clinic room straight away, no sitting in the waiting room, straight into a clinic room. Someone will come in and take your blood. The doctor or the nurse will come and see you straight away. There won't be any waiting around at all. And then as soon as you've been seen, you'll be out again. We're not waiting for the blood results, but we'll give you a call later on with the blood results if there's anything abnormal on there. So you're not going to see anybody else when you come to the clinic apart from the person who actually does the consultation with you, and they will minimise the contact with you to try and lower any risk of transmission either way. So hopefully that's answered that first one. I think there's a follow-up question from the same person.
So they are wondering if they had another condition, for example, a urine infection, which would cause a fever. What should they do in that situation?
No, and this is a key point again, because transplant patients, dialysis patients, anybody picks up other conditions all along that aren't necessarily coronavirus. So what we need to do is we need to know about it. So the first thing to do is, if you've got any symptoms that you're concerned about, is to give the transplant unit a ring and let us know. And what we've got in the unit in Cardiff is what we call a watch list. And this is a list of patients who have been in touch to say they've got some symptoms, whatever it might be, that aren't severe enough to need to actually come into hospital, but also we don't want them to come to the clinic to be assessed for fear of passing anything on to somebody else. So what we're doing for those patients is we are keeping in touch with them regularly by telephone, and one of our consultants, that's their main role at the moment, is phoning patients up, checking them out, making sure that they're okay, and we can give you then that way individualised advice. What we're not COVID-19, so the complications of coronavirus are quite difficult for us to treat on the transplant unit or on the kidney unit. It's not the ideal place to be. So if somebody definitely has those sorts of symptoms, really we want them to be going into the normal hospital system where the whole system is set up for managing those sorts of patients. Occasionally that isn't possible. Occasionally we need to be looking after you. For example, if you're a dialysis patient needing dialysis regularly, then we need to have you on the renal ward where we can look after you. But certainly for transplant patients, it's better if you've got COVID-19 that if you can stay at home to stay at home. And we've got a few patients already that we're doing that, the patients who sound very much like they've got COVID-19, but we'll manage them successfully at home with regular telephone consultations. So that's the idea really. The team is there to help and support you and give you advice. So if you've got doubts, give the unit a ring and they'll be able to give you some individualised advice. Okay, next one.
So the next question is from a patient who has CKD stage 4, and they have put themselves in self-isolation a week ago and have been working from home to try and stay safe. They live with their 3 children and their husband, and their husband is continuing to work and is worried about bringing the virus home from work. So they are asking what precautions should they be taking?
Okay, so CKD 4 on its own doesn't put you into the highest risk, so it doesn't mean that you should be shielding. But self-isolation makes absolute sense, and actually, I mean, we should all be minimising. We should all be practicing social distancing. But for kidney patients, social isolation is what we're recommending. So you're doing the right thing by working at home. In terms of your family, and this is one of the big challenges of this infection, is that when we're asking people to shield and when we're asking people to isolate, we're also asking them to minimise contact with their families and things, and that's the thing that's so difficult to do. For this particular person, the right thing to do is that they are isolating themselves, which is fine, sensible. Their husband should be practicing social distancing, so when they are going out, they're keeping those 2 metre distance from everybody, washing their hands regularly. When the husband comes back from work, first thing to do, as soon as you get in, without touching anything, wash your hands. Ideally, change your clothes, and don't bring stuff home from work. So if you've got laptops and things like that, trying to keep them in work rather than bringing them home if possible. And that way you'll minimise the risk of something coming back into the house.
Okay. So the next question is from a transplant patient, and they are asking if they are well, but someone in their household is showing symptoms, should they stay in the house with them? And then as a sort of a follow-up of that, they have young children, so it would be difficult for them to go elsewhere.
So the shielding advice that's been given by the government is that when you're shielding, you actually minimise contact with anyone within your household as well. So what they're recommending is that you are spending as little time as possible in the company of other people. So if you have to be in the same room as somebody else, then you keep the time as short as possible. Try and keep the air ventilated, so keep a window open if you can. I know it's still a bit cold at the moment, it's not easy to do that. But the window open thing is very relevant, because the data shows us that you're much less likely to catch this where the environment's well ventilated. So if there's air moving around, it's much less likely that you'll catch it through the airborne route, which is somebody coughing or sneezing it and those particles coming over into you. Also, as part of the shielding advice, the recommendation is that you don't sleep in the same bed as anybody else, that you use a separate toilet if that's possible, and if it's not possible, that you clean the toilets before you use it, somebody else cleans it before you use it, so that there's minimise the risk of passing on any infection. Separate towels, separate eating implements and things along those lines. Look, I know these things are incredibly difficult to do for families, that's the reality of it, but this is the best way of reducing the chance of you picking up this infection. So it's a case of striving as best you can, really.
Okay. So the next question then is, what advice can you give on the best way to help with food deliveries for shielding patients?
Okay, so this is one of the challenging areas, because of course part of the shielding advice is that you don't go out at all, even for shopping. So that means somebody else needs to be bringing your shopping back for you. Obviously the best thing is if you've got a family member or a friend who can do that for you. If that absolutely isn't possible and there's nobody who can bring you your shopping, then the advice in Wales is that you contact your local council, and the local council will sort out who will come and deliver your shopping for you. This is evolving, of course, all the time, and what you've all seen, the really positive response from the public about people volunteering to help out. You know, there's loads of people who volunteer to help. I mean, just in Wales, we've had over 1,000 people who volunteer to help drive as volunteer drivers, for example, and that's going to be hugely helpful for us in terms of managing our dialysis populations, getting people to and from dialysis, because we've got people who volunteer to be drivers. So lots of positive response coming in from the community, which is going to help. And this particular person, if you don't have anyone who can get you shopping for you, then phone the local council. They will register that and they'll organise it for you.
Okay. And they are also asking, what is the reason that they are not allowed to go out for a solitary walk?
Okay, well, the shielding advice is that you don't leave the house. Actually, you can go into your own space, you can go into your back garden. I said okay to sit on your front doorstep, providing your neighbours aren't too close, and that's it. The rationale for it is purely and simply that you can meet people who can pass the virus on to you, and the other aspect, of course, is that the virus can live for a certain length of time on surfaces. So if you touch anything that's out around and about, and this applies to things like shopping as well, if you were to go to the supermarket, I know the supermarkets have been really good now about trying to keep hygiene good and all the rest of it, but anywhere where there's people, anywhere that things have been touched, there's a small chance of you picking up the virus from that surface. So that's the rationale why the government are recommending that people don't go out at all as part of the shielding.
Okay. So another question from someone else about a patient who's on dialysis, asking why the staff are not wearing masks.
Okay. Well, the guidance that we have been following has been that doesn't make a difference to transmission, just wearing a mask. And it's a bit controversial, this, because the evidence isn't clear. The masks don't stop transmission completely, and most of the masks that you can buy, or normal surgical masks that I wear as part of my day-to-day job, won't stop the transmission of this virus. I think probably we may see some changes in coming days and weeks about how our dialysis units and our wards and things are managing patients in terms of these personal protective equipments and masks and things in particular. I think we may well find that people are wearing them more often in the coming days. Whether that makes a difference, it's not clear, I have to say. It's not absolutely, nobody's sure that it really makes any difference at all. But my personal view, I think it makes people feel more comfortable, and that's got, when we're trying to, on one hand, tell people to shield, and then on the other hand, we're telling them to come along to the clinic, I think we need to be accepting that we're making people anxious, and that we should be doing everything to reduce that anxiety. So we're working through it, and hopefully we'll have a little bit more continuity across the country with that in the near future.
Okay. They're also asking that on the news there seems to be a lot of information for dialysis patients, for patients in England, but not so much information for the Welsh dialysis patients.
The advice for dialysis patients is the same across the UK, so there's no reason for any different in England or Wales. There's one really useful source of information for you. If you go to the Kidney Care UK website, the front page that comes up on their website is a really nice advice for kidney patients in general. It covers all different aspects. It covers the pre-dialysis patients, it covers dialysis patients, home dialysis patients, transplant patients, everybody. The great thing about that is it's being updated regularly. So, you know, things are changing all the time. What we were saying this time last week, we've had to tweak a little bit now. So that's a really great place to go to get your advice, and there's links to it from the Kidney Wales website as well if you want to go there.
Okay, and they're also asking that the English patients have had their letters about shielding, but not patients in Wales.
Yeah, the shielding letters in Wales have been sent out by the Welsh Government, and I'm hearing from quite a few people that they've been a little bit slow to get out. I know some people have received them, but they are on their way. You should be getting them in the next day or two if you haven't already. Don't wait for the letter to come through. I'm telling you, if you're a transplant patient, you should be shielding. That's the advice. You should be shielding. You can find the exact information on Welsh Government website. It's no different to the English one. There's some slight subtleties about who you contact if you need help, but all the other advice is exactly the same. So if you're a transplant patient, don't wait for the letter. You need to be shielding.
Okay, so the next question is someone asking for some advice. They've had two contradictory letters, one from University Hospital of Wales telling them to keep appointments and that they can pick up their medication then, and then another from Mamilad House telling them to totally isolate and that all medications would be delivered. So they're just asking for clarification.
Yeah, I know it's confusing because there are a few different sources writing to people separately. If you're a transplant recipient, actually any kidney patient, if the kidney unit is asking you to come for an appointment, that means that they need to see you. If you've got anxieties about it, give them a call beforehand and just double check. But I promise you, every single appointment that across the whole of the country, everyone has looked through it to see whether or not we need to see that patient or not. If there's any chance we can do it without you being in hospital, it will have been done already. So bottom line is, if you've got an appointment to come to the hospital, then that means we need to see you.
Okay, so the next question is from a patient who had their transplant 13 years ago, who is a keen runner, but the guidance that they've read is that they can't go out at all, and they're just asking, is that true, or can they at least go out for a walk?
No, the advice is to stay indoors completely, and as a keen runner myself, I would be deeply depressed with that, but that is the advice. It's really a case of trying to find some alternative ways to exercise, and one of the great things is there's loads of other ways to do it. This is the time to get that strength and conditioning that you've always been meaning to do for your running under your belt. You would have seen already in the news things like the Joe Wicks workouts. There's a live one in the morning for the kids, but he's got loads of them on his YouTube channel. I used to do quite a few of these. They're really good, and they will give you excellent workouts in a short space of time. You can do them anywhere. You don't need any kit. So those sorts of things are the sorts of things that I would be recommending you do, and the benefit of exercise in terms of your kind of well-being and the physical elements that go with that shouldn't be underestimated, and that's why part of the not going out is challenging, but please don't think that means you can't exercise. Absolutely you can.
Okay, they also work full-time, and because of the isolation at the moment, they're only receiving statutory sick pay, and so they are losing out on a substantial amount of money every month. Is there any more help out there for them.
Okay, so anyone who's been advised to shield, then that is a medical request for you to stay at home, so you should be entitled to all full allowances. I have to say I'm not that au fait on and it will be different from different companies in terms of when they have statutory sick pay and when there's some other system in place. I know that the government website is quite helpful about advising on all of the different elements of financial support that can be provided during this outbreak. From a financial perspective, this has really affected so many different people in so many different ways. Several members of my family have been directly affected by this, and it is enormously challenging. No one's underestimating that. There are some measures in place to help from the government. I would say hunt those out and see which ones of them apply to you. I suppose one of the messages I'd like to say is to try and put your health ahead of all those things. I know that's not always that simple to do, but it's really so important that you are looking after yourselves through this time.
Okay, so the next question is from a patient that's had their kidney transplant 5 years ago, who is a farm worker. They are asking if there's any way to be tested for antigens to see if they've already had the virus.
That's a great question, and one that you've probably seen a bit of stuff in the news last week about. So the antigen testing. So this is there's different ways of testing for virus. You can check to see whether you have it at the moment, and you can check to see whether you have ever had it. The check to see if you've got it at the moment is usually done with a swab at the moment, and they're looking for signs that the virus is in your system somewhere. There has been a little bit of a shortage of those, which is part of the reason why there isn't been absolutely enormously widespread testing, and you will have seen that even the frontline healthcare workers haven't been getting swabbed when they've been symptomatic. The testing is ramping up. We're getting more and more of the kits available, so we will be able to test more and more people. There are issues with the test that we need to bear in mind. It's not always that helpful, and if you don't have symptoms, you don't need a test, because it won't change what you need to do. If you have mild symptoms, then you need to tell your kidney team and you need to self-isolate, okay? And that won't change unless you become more unwell or you are more unwell to begin with. The key thing is that if you're involving your kidney team in this early on, we can give you individualised advice. You know, if you're a transplant patient, we're looking after you in Cardiff, we'll put you on the watch list, we'll keep an eye on you, we'll phone you regularly and make sure that you're keeping well, and can advise if anything changes on that score.
Okay.
The antibody testing is something that we don't have yet. So this is to test whether people have ever had the virus. This is what the government are telling us they're going to have. They keep saying it's going to come in a week or whatever. It's very ambitious, but that will be helpful for us if we can have those tests. But it's because if we know that you've had it, then you're much less likely to pick it up a second time. But probably leading on to the next question, it doesn't completely exclude you getting it a second time. That's the bit we're not sure of at the moment. We don't know whether if you've had it once, whether you can get it again or not.
Okay, so that's answered the next question. But then another question is, what can he do to protect himself when working on the farm, other than washing his hands and keeping his distance from the other workers?
Well, as a transplant patient, the advice is that you don't work on the farm. Now, the government are clear about the fact this is advice. No one's going to mandate you to do these. No one's going to insist on you doing them. But it really is good advice to be staying in. Hand washing makes a huge difference. Huge difference. It's the single most important thing after the social distancing that we can do. So definitely washing hands regularly is really important. Minimising contact with anybody else, of course, goes without saying. But you know, staying in the house is probably the best thing in that scenario.
Okay, and then they're also asking, what can they do as a family to support each other when the wife and son are both key workers and have to work?
We're seeing more and more problems like this where members of the family, some have to work and others can be at home, or somebody's shielding and another member of the family is a doctor who needs to go into work, for example. The thing to bear in mind there is that if the person who's leaving the house is carefully practicing social distancing, then you'll minimise the risk of bringing anything back. Then making a conscious effort when you do get back to the house to actually stop, wash your hands, change your clothes, try not to touch anything in the house that the other person is going to touch until you've completely washed your hands and changed your clothes, and don't bring any of the kit that you're using in work into the environment that the person who needs to be shielded is going to be going into. Look, these are really difficult things to do, but that's the advice that we're giving. I can tell you there's quite a lot of doctors and nurses who are choosing to actually move out from their families because it's complicated to do all of those things, and they're worried about bringing infections back. That's not practical for everybody. I don't know that it's necessary either, but there is anxiety amongst the community in general, not just the kidney community, about those aspects of it. I think, look, having spent a lot of time looking through all the evidence that's out there and what people have done in the different countries, what is clear is that you can really make a difference by washing your hands regularly. And as I said earlier on, if you don't touch your face, then even if it's on your hands, it won't get into your face. But it's amazing how often you touch your face. You will have seen me already. I've done it several times during this video, I know. It's so difficult to avoid doing that.
Okay.
Next one.
Next question. So I'm a home dialysis patient, and I understand that transplants are currently on hold. What is the plan to restart transplants?
Okay, so fantastic. Home dialysis patients, this is where you absolutely come into your own, of course, because you can look after yourself, and absolutely great that you're doing home dialysis. Transplant wise, so we took a decision a couple of weeks ago in Cardiff, and we look after the patients for South and Mid Wales. The North Wales patients are managed in Liverpool, but for the South Wales patients, we took a decision a couple of weeks ago that we would pause our transplant programme, so we would not transplant any new patients. And this was an incredibly difficult decision because obviously, you know, transplantation is life transforming for so many people, and in the long term often extends life as well. But in the short term, it doesn't save life. There is an alternative, which is dialysis. The big problem with being a newly transplanted patient is that those first few weeks and few months after a transplant is when your immune system is at the lowest ebb. And it's also the time when we need to see you a lot in the hospital. We can't manage you remotely. We can't leave you at home and just phone you up. We need to do regular blood tests. We need to do a variety of different investigations, which means we need to see you regularly. So we've got that almost perfect storm of you being at your lowest ebb, us needing to see you, and the only place at the moment that we can see people is in a hospital, which is all the hospitals in Wales have COVID patients in them now. There are some other aspects about this that help make that decision at the point we made it, that the donors weren't all being tested for coronavirus, and we can't still test our recipients. If we wanted to do a kidney transplant, we can't test them before we did that. And then the other aspect is we're already experiencing a lot of staff sickness, so we really didn't want to be in the scenario where we're trying to manage some incredibly complicated patients who were getting more and more unwell, and we had fewer and fewer staff to deal with them. So after lots of consultation and consideration, we made the decision to pause our transplant programme. In terms of when we're going to restart it, that depends very much on what happens over the next few weeks. We're gathering information from around the world at the same time. Just for information, most of the other transplant units in the UK have stopped transplanting. The entire programme in France and Spain have stopped. Italy has basically stopped. There's a couple of places in Italy that haven't been affected and they're still continuing, but everywhere else, other countries like Singapore, who've had really great success with managing this outbreak, have paused their transplant programme likewise. So kidney and pancreas wise, we're not doing any more transplants. You may still see some transplant activity reported, and these are mostly for people who need immediately life-saving operations. So these are people who need a liver transplant or a heart transplant, and without it they won't survive for the next week. In that scenario, of course, you know, any of the other risks that go with COVID need to be accepted. So there are still some transplants going on, but they're not going on amongst the kidney patients in Wales. The North Wales, the Liverpool unit who cover the North Wales likewise aren't transplanting now either. So it applies to everybody in Wales.
Okay.
I think that answers that.
Yep. Okay, so the next question is from a patient who's a 45-year-old diabetic who's also had a leg amputation and had pneumonia in 2018. She had her transplant in 2019, and they were just asking if they were to catch COVID-19, how likely it would be that they would pass away from it.
Okay, well, so even for transplant patients, the majority of people who get this will get a mild illness and they'll recover completely from it. What we don't know for sure, the effect that being a transplant patient has on the severity of the disease. Everything we know about transplantation and our immune system says that you're likely to get more severe illness if you do have if you are on immunosuppression, if you're on the anti-rejection medication. The early data from Italy backs that up, so that's showing that kidney transplant patients in particular, if they get a serious illness that requires them going to intensive care, don't do as well as the general population. Some more reassuring data from other parts of the world. In the US, a lot of their patients, the transplant patients who are getting it, seem to be getting relatively mild illnesses and recovering. We've got several patients already that we're looking after who have this, and many of them have already recovered. So it certainly isn't all doom and gloom, but I wouldn't want to take that risk if I was you, and that's the reason why I would suggest minimise your risk, go for the shielding, get your family members to be really diligent with their social distancing, and then you won't pick it up, and then you don't need to worry about any of it.
Okay. So the next question is someone who's based over in West Wales. So they are shielding for 12 weeks, and so they're going to need to get some more prescriptions. Can they get them sent over to a local pharmacy rather than having to drive down to Cardiff to pick them up?
I don't think you'd have to come to Cardiff, that's for sure. I mean, your general medication that you normally get from your GP, what would normally be the case is that you can have that delivered to your home, certainly to your local pharmacy, and someone can pick that up for you, or they'll deliver it to your home. We need to just get in touch with your local pharmacy or your GP to ask about that. In terms of the anti-rejection medications, most of those in Wales are prescribed by the kidney units. Each of the units have got slightly different approaches as to how they're doing it, but they're all very happy for you to contact them and ask them, how do I get my drugs? Because one thing that I haven't said yet, but I really want to emphasise, is we don't want transplant patients to stop their medication. We don't want you to say, oh no, I'm worried about picking up an infection, I'll lower my drugs. That's a really bad idea. So don't make any changes to your medication unless somebody from the kidney team tell you to do so. For patients, we don't, obviously this is for at least 3 months, it may be longer than that, we don't know. You may well run out of medication. Your transplant pharmacy will be able to advise you on how they're going to get meds to you. Certainly in Cardiff, they're happy to have emails or phone calls, and they can arrange for a prescription to be made ready for you for somebody to pick up. Or if that's not possible, give them a call and they can talk through the alternatives with you.
Okay, so the next question is from a patient who's had a failed transplant and on dialysis, but they're still taking the tacrolimus, and they're asking if they should continue it or stop.
Same applies, don't change anything unless somebody from the kidney team advises you to, so carry on with the tacrolimus.
Okay, they are also saying that they're on the very high risk group, but their wife is a GP. Does their family have to stay indoors with them, and is she allowed to go to work as she would be a higher risk?
So if you're on the very high risk group yourself, then that means you should be shielding, which means you should be minimising contact with your family members who are staying in the same house as you. The advice is that your family members can still go out to work, so your wife can still carry on working, but needs to be really diligent about her social distancing, which I'm sure she's a GP, she's already on to that. This goes back to what I was talking about earlier on, where these are really difficult decisions we're asking people to make about minimising contact with our nearest and dearest. But I think that we're going to come through all of this. This is going to be a finite period of time, and we need to be, for our certain group of patients and our transplant patients and some of them, we've got to be really protective of you right now, and that means you as patients being protective. It means everyone around doing our best to try and look after you as well, because by far the best scenario is not to have this virus at all.
Okay, so the next question is from a family member. Their mother has had a transplant and is continuing, however, to go out for a walk or a bike ride and not listening to their advice, telling her not to.
Okay, naughty patient. Well, look, we give advice, we don't mandate anything, but the strong advice for patients who have had a kidney transplant is that they don't go out. And fully appreciate how difficult that is, but that is the recommendation, that you stay in the house, that you minimise contact with anyone who doesn't live in your house, and that you change your exercise from that daily walk to something else. It doesn't have to be a Joe Wicks workout, by the way. There's lots of other things that you can do. The NHS website, I've got lots of advice and guidance on simple little exercises that you can do that keep your muscles moving, that keep you in shape, that you don't need to do anything too fancy with, and that's what we're recommending really, that you swap your daily walk for something like that instead.
Okay. So the next question is from a patient who has glomerulonephritis. Their last kidney function test was 70. They also have diabetes, high blood pressure, and an underactive thyroid, and they're asking if they are in the high risk group.
So from a kidney perspective, that kidney function just about puts you in stage 2 chronic kidney disease, so that's not in the highest risk group. The other conditions on their own wouldn't put you in that group either, so it does, from what you've said, it doesn't sound like you are in the highest risk group. If you've got some doubts, have a chat with your GP, because there may be something that I'm missing there about some treatments that you've had in the past that might change that, but from what you've said, it doesn't sound like you're in the highest risk group.
Okay. So the next question is from a patient who's asking when they will get their letter regarding what they should do in terms of shielding.
I think we've covered that already. They're coming out. If you want to know what's on them now, it's there on the website, on the government website if you want to, and I don't know, we can probably put a link up as well somewhere so that you can get access to that. It's exactly the same as what's on the English advice. The difference is about who to contact about if you need some social support.
Okay, and then they're also asking similar question about if a transplant patient gets the virus, will they all have severe disease, or will there be some that have minor symptoms?
No, most will still get minor symptoms, but you don't want to take that risk. So I would say just try and avoid picking this up if you can.
The next question is from someone that has heard that tea has elements that can decrease or cure the coronavirus, and is that true?
No.
Okay. So next question is from someone, and these have come in through the comments, that was treated before their transplant with Tamiflu, as one of the other dialysis patients had influenza. Does that cover them?
It doesn't, unfortunately. Tamiflu doesn't work for this virus. There's lots. We haven't found anything effective yet across the world for treating this. There's a few things that have shown some promise, but nothing is working fantastically. So the only thing that we're able to do right now is provide what we call supportive care. So that means that we support your body while you get through it. And if you get the severe end of the disease, where you're needing oxygen support and a ventilator and things, it's about caring for you in that scenario, and again, allowing your body to recover. There's quite a few big trials now going on, and everything's being pushed through much quicker than we would normally get them through. These things usually take months and years to get up and running, and they're taking days in this scenario. I'd tell you one of the things, it's been absolutely fantastic being in the NHS these last few weeks, because they've just cut all of the red tape out, and you just get things done, everybody pulling together, everybody wanting to help. It's been absolutely fantastic. You've seen the same thing in the communities as well, of course, that everybody wants to help out in some way. So, this is a horrible time, but there's a lot of positives that are going to come out from this. And actually, in terms of how we deliver our healthcare, I think will change forever actually from this. I mean, we've already had experiences of, for example, the clinic that make us think, do you know what, maybe we need to run it a bit differently anyway. I know my wife was saying the same thing about video consultations for her patients in general practice. I think we're going to change in a positive way in all sorts of different ways, and that's without even starting talking about how we're allowing the earth to breathe for once without all of our consuming all our fossil fuels. So there are some positives going on at the moment. I've totally lost track of what I was talking about now, but I think did I answer
Tamiflu, you did answer it.
Yes. Yeah, so Tamiflu doesn't work for this. We're exploring a few other antivirals. At the moment, there isn't anything that's definitely fantastic. There may be some that help a little bit, and we'll get the answers on that, I suspect, fairly soon.
Okay. So my daughter has had a transplant. What should I do if someone in my house gets it? There are 6 of us in our house.
So your daughter absolutely needs to stay away from anyone who's got any sort of symptoms at all. Anyone who's got a cough, anyone who's got a fever, anyone that you're concerned about, they need to stay away from your daughter. I would recommend trying to minimise her contact with the rest of the family as much as possible. It's not easy, particularly with children. I suppose the one thing we haven't covered so far is that children, even the children who are immunosuppressed, or children post-transplant, as far as we know, they do very well after this. They get very mild illnesses and really bounce back quickly. I would say try and be cautious and try and minimise the contact with other people if possible, but probably for the children, you're in the children are in probably the best place of anybody actually with this.
Okay. Next question is, where would we have dialysis if we have symptoms?
That depends. It depends on how unwell you are, really. If you're unwell enough to be needing oxygen treatments and things like that, then it will more than likely be in one of the kidney hospitals, depending on what your nearest kidney hospital is. If your symptoms are mild and you're still able to be going to dialysis, then it could be that we'll deliver you'll carry on having your dialysis in the units, and we'll just take extra precautions to protect you and other people from spreading the virus. So we do have a few patients around and about who we're managing in isolation in the dialysis units. So it really depends how well you are, about where we'll look after you.
And then, once a vaccine is developed for COVID-19, can transplant patients receive this?
We hope so. The vaccine that we're hopeful for, but one of the things we're not sure about is whether or not this virus responds to the vaccine. And it's really difficult to know. Vaccines work differently for different diseases. So you probably know with the flu vaccine, for example, it protects against many strains of flu, but not all strains of flu. And you also know you need to have it every year. So in other words, the virus changes a little bit every year, and you can get 2 episodes of flu in your lifetime, of course. Other viruses, things like measles and stuff like that, you have it once, you never get it again. We don't know with this virus yet where it's going to fall in those things. If it's one of those ones that when you've had it once, you can't ever get it again, that will be fantastic. That'll make things so much easier, because even patients who've had it once will be effectively vaccinated, and those who haven't will be able to give the vaccine to and reduce the chance of them picking it up. So it will certainly help us to get our transplant program back up and running. I think there may be ways of us getting our transplant program back without relying on that vaccine though. I think once the situation calms down, once the number of people who've got it in the community is less, once we've got our processes for managing, getting the swabs reliably, getting the testing done reliably, and having somewhere we can look after patients that isn't surrounded by other either staff members or patients who may have it, we'll probably be able to get going again with a transplant. But I think realistically we're talking about months there rather than weeks.
So I think there are still some questions coming through, but I think seeing as we've been going nearly an hour, it's proposed that we...
Okay, I've been voted out by my wife. She's fed up of seeing me, so it looks like we're going to have to call it a day there. If any of the questions that we haven't answered, we can try and get some answers directly to you. So just either email them through. What's the best way of doing it? Write a comment on the page. That's the best way, and then we can try and answer any of the other questions that we haven't covered. So there we go. We'll wrap it up there. Stay safe, everybody, and be positive, because if you follow the advice, the chance of you getting any of this thing is really small. And even if you do it, if you do get it, the chances are that you're going to be okay. We've got a fantastic team of doctors and nurses from the NHS who are going to look after you through this. We've got a fantastic team here in Kidney Wales who can help give you advice. We've got a fantastic psychology team who can help you with your mental health through all of this. So you're in the best place possible in Wales for us to look after you. So stay positive. Good night, everybody.